No, I do not. Hi, Dr. Rafich, how are you?
Good. How you doing?
Good, thank you.
Thanks for having me.
Thank you for making the time. We appreciate it.
It would have been cooler to fly down, hopefully you guys have warm weather and stuff,
Yeah, it's rarely gotten below 80 degrees while we've been here, and we've been here for about a year. So definitely would be a place if you like the warmth.
I love it. Yeah. I'm in Las Vegas, so it gets pretty hot.
Ah, okay. Say good. No. Okay, good. Okay. So thank you so much for your patience. So sorry, we had to coordinate a few things for the logistics.
Good. It's all good. Thank you. No problem. I forgot how long did you want this to be? I presume like an hour or 40 minutes or something.
Yeah, usually about 40-45 minutes is what we aim for.
Okay. Great. And is everybody here like first year, second year?
It
or
varies.
Later?
It varies.
Oh,
so I think a couple of us are considered third year, and then ranging from like second to third.
Okay.
Let's give everyone another minute to just come on.
Yeah. Again, I'm not too familiar with Zoom. I think I just share my screen, right? And then you guys will see it. Okay.
Yes. So let me just make sure that you are able to be host.
Sure.
Okay. So yep, you should be able to share your screen now.
Okay, perfect. Let me see. So many windows. Okay, so Keynote, I think.
I'm sorry.
So I'm reading these things.
No problem.
Yeah. I'm an old person trying to figure out technology. I'm guessing it didn't work. Let's see. Try again. Oh, there we go. Okay, Keynote. There it is. Pyometra, share. Oh, okay. Do you see something now? Okay. I don't know if I can't hear you guys now. Though. I don't know if it's on purpose or not.
I muted myself. Sorry. Yep, we're all good.
Oh, good. Okay, cool. All right.
So whenever you're ready, we can go ahead and get started. I can just do a quick intro for you.
Oh, sure.
All righty. So good evening, everyone. My name is Laura. I'm the president of the SAE Club. I'm just going to do a quick introduction before Dr. Rafich starts. So after completing his studies at Cornell, Dr. Rafich participated in an intense one-year small animal medicine and surgery rotating internship at Angel Animal Medical Center in Boston, Massachusetts. This was followed by 2 rigorous one-year small animal surgical internships at Long Island Veterinary Specialist in Plainview, New York. Dr. Rafich achieved his board certification in small animal surgery by completing a 3-year small animal surgery residency at Lids, and subsequently became a diplomat of the American College of Veterinary Surgeons, AACVS, also operating in a variety of settings in brick and mortar. He launched Vet Triage in late 2019 and has been both a vet televeterinarian and strong proponent of televeterinary medicine ever since. And without further ado, Dr. Rafich.
Thanks. Thank you for having me. This is great. So yeah, we'll talk about pyometra, or more technically known as cystic endometrial hyperplasia-pyometra complex. We'll go over what that's about. This will be our outline here. We'll go through all these topics. There's a handout that I shared that will have these items detailed in way more depth than we'll go through here. And so this is a very cursory, superficial visualization of pyometra, but the notes that we gave you will be able for you to be used for like references and things like that. So no need to take notes or anything like that. And if anybody has any questions, feel free. Otherwise, I assume you'll share this after the talk is done, and anybody has questions thereafter can always reach out to me separately if they want with further questions. So we'll go over all these items here. You went over my background already. Thank you for that. So we can begin with the pyometra. So this is a very common condition in dogs, and you can see in cats too, but quite uncommonly. It's mostly a dog disease. So cystic endometrial hyperplasia pyometra complex. It has an incidence of 19 to 25% by 10 years of age. It's the most common intact female disease of dogs. And the affected patients can range in age from 6 months to 18 years. So it's any age dog, but typically they are over 4 to 6 years of age. So they're around the middle age to older group. This is a picture of a thickened uterus cross section, which I presume the students there would have a better idea of what's depicted there more clear than I can. So the signalment over 4 years of age, typically they usually have had their last heat a few weeks prior to presentation. I will frequently find clinically that it's somewhere between 2 and 4 weeks that they began showing signs, but the literature will report they typically have had their last heat 2 months prior. Most of these dogs have never had a litter, and so primiparous and multiparous females are less commonly affected by pyometra, although they still can be, but nulliparous patients are more commonly seen with pyometra. So it's impossible to talk about pyometra without going over at least some of the anatomy, and then of course the hormonal changes, because this is really a hormonal disease. So anatomy of the reproductive tract of the females, ovaries, uterine horns, the uterus, the cervix, and there's a lateral view of a drawing of a dog with the anatomy there. And you can see how it's positioned relative to the urinary bladder and the kidneys and ureters. And the hormonal changes are really where the bulk of the notes that I gave you are going to go into depth here, because this is the entire disease based on this. So although it can happen, pyometra can occur during anestrus or even during pregnancy. Usually it's right after estrus is completed, during the diestrus, either early or late diestrus phases. So when you look in the chart there, as the estrogen is declining in concentration, the progesterone is elevating, and this really is a progesterone initiated disease. That's typically when you're going to see it. And so the patients that are affected by this, they are either having a hormonal imbalance, so their estrogen and progesterone ratios are off, or each hormone on its own are off, abnormal concentrations, or the patient herself is having kind of an unusual response to the hormones. And so that's typically the two scenarios that you're going to see with these pets. Now, the source of progesterone either is going to be from the body, or it can be externally administered as well, and you'll get the same sort of changes if the dog is receiving their large amounts of hormone, or again, they have an exaggerated response to that hormone. But that typically is when you're going to see this condition, is during the diestrus phase. But again, it's typically a few weeks after estrus is completed. And so that's progesterone there. And then a close-up view of what we're talking about here. So the initial stages are going to be a thickened uterine lining with cystic formation. So all those thin-walled cysts there, which you can imagine they're secreting fluids, and that's going to initiate the stages of pyometra, and it's all again hormonally induced. So they'll talk about in the literature types of pyometra or stages. There really should be stages. This is types 1 and type 4 is more of a progression of disease rather than separate entities. Type 1 is that gross picture again of the cystic hyperplastic endometrium. And so that's the beginnings of it. And that's when you see the secretions and the natural defenses of the uterus are starting to decline. Stage 2 there, or type 2, is the elevation of progesterone. So that chemical structure is estrogen there, and then right next to it is progesterone. And says this is when you're seeing progesterone elevations. Type 3 is now you're starting to see basically when clinical signs begin. So on that bottom picture, plasma cells are starting to accumulate in the endometrium, causing inflammation, and then the clinical signs. And then stage 4, you've got the complex cystic endometrial hyperplasia-pyometra complex is now in full swing, and that's associated either with an open or closed cervix. And to the ultrasound picture there, you can see is a thickened uterus, and what you're going to see with these patients clinically. You can have aclinical pyometra as well, but the vast majority of these cases are going to show up with clinical signs of varying degrees. So clinically speaking, when you talk about the types of pyometra, you're really not going to notice, if you're not showing clinical signs, then chances are you're not going to see them come through. And so typically you're probably seeing these patients as type 3 or type 4 because they had that clinical signs in order to come in usually. Although I've had conditions where I've found abnormalities of the uterus on ultrasound when you're looking for something wrong. And so in those cases, who knows? Are those just not as affected dogs, or are they in early stages? An important thing to remember with a lot of conditions, not just pyometra, is a systemic inflammatory response syndrome, so SIRS. This chart shows the objective measurements for SIRS in cats, dogs, and people. The reason why this matters is because pyometra is no different. Any inflammatory or infectious condition can result in SIRS, and so those are your parameters there. It matters from a prognostic standpoint, but also just so you, as you go through clinical training, keep this in mind, because we seldom will say, oh, this patient's in SIRS clinically, although this combination of abnormalities is actually quite common for many conditions. So you just keep it in mind, really. And of course, SIRS and sepsis have intertwining parameters, obviously, because it's affecting the body in systemic fashion. And that's actually another good point. We always think of pyometra as just affecting the reproductive organs, but it's actually a systemic problem at the end of the day. It's going to affect the body in multiple ways, and we'll go over that. And E. coli is typically the bacteria that is most commonly implicated. It's naturally found in the reproductive tract anyway. And if you have a condition, if you have a pyometra where the patient has, let's say, more than one bacteria involved, the cultures will always have E. coli, always. So E. coli is either is the only bacteria that you find on a culture test, or if there's more than one bacteria, one of them is going to be E. coli. And the uropathogenic version of E. coli, it has characteristics that are different than the fecal E. coli. And those features are what creates some of the downstream changes to the dog's body because of the unique features of this E. coli. So this slide is meant to go over you can have typically gram-negative bacteria. You can actually have gram-positive. And when you look at different categories of peritonitis, so primary versus secondary peritonitis, gram-positive bacteria typically are implicated with primary peritonitis, whereas gram-negative secondary peritonitis. And gram-negative infections are way more common in every aspect of small animal medicine, including pyometra. Gram-negative is what you're basically going to see, but just wanted to remind everybody that gram-positives can play a role. And again, these are detailed more in your notes. These are the factors that are the reason why E. coli is so influences the body in a systemic fashion. So obviously, again, clinically, you're not going to know any of this. This is purely on a microscopic level. It's just based on what the bacteria does from studies. But these are factors that you're going to see repeated through other diseases as well. And so the main point here are the last 2 points: endotoxin or lipopolysaccharide, LPS, and then immune complex deposition. Oops, complex is spelled wrong. So endotoxin or LPS is a unique characteristic of the gram-negative bacteria. So that structure there on the screen is what LPS is made of. And this is what influences the body in a systemic way. And we'll talk about it more in terms of the kidneys, because that's really where this matters the most clinically. And then immune complex deposition, so that unison of antibody and antigen. If you have disease of any kind, especially severe disease, especially diseases that affects the body systemically, well, immune complexes can deposit themselves in anywhere in the body. And in this case, especially somewhat the liver, but really the kidneys. And so those last 2 factors there really matter clinically for these pets. So the multisystemic fashion of this condition is depicted here. When you have a patient that has pyometra and you are working them up, you're obviously one of your diagnostics are going to be the basic blood work, so chemistry panel and a complete blood count or a CBC. So liver there depicted in the picture, and then kidneys there. You're going to see those changes potentially, not every patient, but you can have elevations of any number of liver enzymes. Azotemia it can be seen, again, not always, but can be seen. That globular structure there, that's albumin. And so because of the effects of endotoxin on the kidneys, it'll result in proteinuria, and that can cause the PUPD that you'll see in these dogs. Again, we'll go over clinical signs here in a moment, but that's just to tie all this together. And then the bottom there is the drawing of the immune complexes. So the antibody attaching to antigen and then depositing themselves in certain areas of the body, the kidneys being notoriously affected by complexes like this. So when you have an infection as like you see in pyometra, the endotoxin or LPS, among other factors, but that's the main one that we're focusing on here. It ends up attaching itself to the nephron, and specifically the distal collecting tubule and the collecting ducts is where it's going to deposit, and then it causes an apposition to antidiuretic hormone. So ADH won't be able to function as it normally should, and you end up with hypostenuria, so low specific gravity on the urinalysis, and you'll end up with protein loss, and that'll show clinically as proteinuria. And so tubular interstitial nephritis, glomerulosclerosis, these are just histological names of conditions that can affect the kidneys. Again, not just pyometra, but other conditions as well. But specifically in our case, we're talking about pyometra. Acute and chronic renal failure, it's tough, right? Because if you're seeing a hypostenuria and proteinuria, which are some hallmarks of renal failure, well, we don't really know if these patients had prior workups performed for whatever reason and never had kidney disease. Now all of a sudden, in conjunction with pyometra, seem to have kidney disease on their blood work. It's important to differentiate. It's important to differentiate that, identify it first, and then whether or not it's going to become a permanent change to the kidneys, we don't really know. You have to treat the inciting factor, right? So whether that patient will have long-lasting is currently being affected by acute or chronic renal failure, and will those changes to the kidneys be detrimental to their life long term, we're not going to know. You have to treat the primary condition and then find out from there. The reason why this matters is because when you have a discussion with a pet owner regarding the diagnosis and then now the proposed treatment for pyometra, kidney disease, either temporary or permanent, has to be discussed with them so they can be aware that the toxins from the bacteria, usually E. coli, can cause permanent, not always, changes to the kidneys. And so those things have to be addressed during the treatment of the condition, but also we don't know where it's going to go thereafter. So pyometra is pretty cool because it affects multiple organs, and most of these conditions, if I give talks about them, I'm starting off with clinical signs, signalment, history, and then we talk about pathophys. But it's difficult with pyometra to not go right into pathophysiology first because there's so much to it. And when you look at your notes, you'll see the amount of detail that's given to the pathophysiology on a more microscopic scale. But clinical signs, your typical vomiting, diarrhea, lethargy, anorexia. The hallmark really is going to be PUPDs, to polyuria, polydipsia. And if you quiz the clients about the dog's history, they typically will think about it and say, oh yeah, she has been drinking a lot and peeing a lot the past few weeks. And sometimes they'll know when their last heat is, sometimes they won't. But all that combination of history can help sort of steer you in the right direction before you even have diagnostics performed. You've got a middle-aged, intact female, right, with vaginal discharge, although not always, but usually, and PUPD, and the last heat ended 3, 4, 6, 8 weeks ago. Pyometra is starting to climb up on your list of differentials before you even begin the diagnostics to confirm it. Now, we did mention, of course, some can be aclinical as well. So why some pets get really ill from pyometra and why don't, we don't know. We typically do see clinically that a closed cervix, a closed pyometra, they usually are sicker. And that kind of makes sense. If the cervix is closed, the discharge from the uterus can't escape. And so that all those inflammatory mediators, the bacteria are stuck in the body. And so you end up with a patient who's going to be sicker, right? So that's what we typically will see, but it can vary. So your typical physical exam findings, you're going to have that dog with pretty disgusting purulent discharge from the vagina, and they may have other chronic changes associated with their mammary glands. The vulva itself could be thick. thickened as well. And then you've got the discharge. So this is your typical pyometra. And the discharge back there can be bloody. It can be more pus-like. It can be serosanguinous. It varies depending on the pet. So you're starting with your minimum database, and we've already mentioned some of the changes you'll see on a chemistry panel. On a CBC, you can all guess you're going to end up seeing leukocytosis typically, right? However, you can actually see leukopenia, neutropenia with these cases too. And why would that be? The white blood cells are normally in the vascular space are now in the uterine lumen. So when you draw that blood work and you run it and you realize, oh boy, the white blood cells are either normal or low, but everything else kind of fits a pyometra. What's up with that? Well, that's what's happening. The leukocytes are sequestering themselves in the uterine lumen. And so that's why they're not in the vascular space, and therefore they're not showing up on your blood work. Now, whether or not those pets are going to be sicker than others, don't really know. It depends on the dog. I typically see that if they do have a leukopenia, or normal leukocyte counts, they're typically sicker than those that have a leukocytosis. And those usually are associated with closed pyometra. But again, that's my own experience with that. And the red blood cell picture there, the erythrocytes, just to show they could be anemic as well. And the differentials for anemia are going to be the same like any other anemic patient. It's going to be either a loss or sequestering or decreased production, or it's going to be destruction of the red blood cells. Those are your four categories, regardless of what disease you're talking about. Those are always your four categories, and it could be more than one category as well. But that's more academic. Well, no, it's not academic. It's actually quite clinical. But just so you keep that in mind whenever you see anemia going forward for any patient, those are your four categories. It's always going to be that case: sequestering, loss, destruction, or decreased production. This is the meat of it, right? You're trying to find that distended uterus. Now, not every patient is going to be so dramatically affected with fluid distended uterus. Some can be actually quite subtle, and some you won't see on radiographs, and an ultrasound is what's needed to show it. Or, you could argue, of course, CAT scan, MRI could do it, obviously, but these are cases that typically are being diagnosed fairly quickly with rudimentary diagnostics. So on the one image there is a lateral plain radiograph of an abdominal cavity of a dog, and you can see there the very distended uterus and ovarian tubes there lining the abdominal floor. I don't have a laser pointer, but you can see the kidneys there are located right the dorsal to the fluid-filled swelling mass effect. You can see that you can't even tell where the small intestines are. You can sort of see a wispiness there, but they're being displaced by this distended uterus. And the stomach, you can't really see it either. You see the liver there over by the ribs, and that's pretty much it. This is a beautiful radiograph of a dog with pyometra, and you can see how prominent the nipples there are on the ventral portion of the radiograph as well. So it just kind of goes along with all the hormonal changes. On the VD view, same thing. You're seeing bilateral distension of the uterine horns. It's perfect. You may be lucky enough to see this. Otherwise, it's going to have to be based on ultrasound. And so ultrasound. So on the one side there, you can see the urinary bladder. It's labeled, and then the bifurcation of the uterine horns, the fluid filled. On the sagittal view of the uterus or of the abdominal cavity, you've got left kidney, that's LK, and the fluid-filled uterus there, distended and what have you. It's hard to see uterine horns and ovaries on a patient that has normal and anatomic structures. Although you can, if you're really good ultrasonographer, you can see those. Typically, if they're becoming more visible, particularly if they're fluid-filled, you have to think, okay, is this a dog that's just in heat, or is this actual the disease? And so that's where your history really matters in these cases, and of course your blood work. And by the way, we kind of give a lot of emphasis on palpating these dogs' abdomens and fearing rupture of the uterus. So you can see peritonitis, like we mentioned. You can have uterine rupture either from the disease itself or because somebody pushed too hard. And so I've never manually caused a uterine rupture in these dogs. In surgery, yes, because sometimes they're so thin-walled and distended that it pops like a water balloon. Those are make the surgery a lot longer and obviously a lot messier, because now you have increased risk of infection, which sucks, but it happens. It's surgery. But preoperatively, I've never had that happen where either myself or a colleague ruptured the uterus, but I guess something to consider if you're strongly suspecting pyometra, maybe not push too hard on the abdomen. And also if you're trying to collect a urine sample, maybe a cystocentesis blindly performed is not a good idea. You may want to do that with ultrasound guidance if you're trying to grab a sterile urine sample preoperatively. Now, the notes I gave you, again, will go into way more detail regarding the medical and surgical options here. And we'll talk about why I'm even talking about medical management here, because surgery is the treatment of choice for pyometra. It is a surgical condition. And if it's not managed by some method, these patients will decline and then they can die from this. So you want to treat it somehow. So surgery is the way to go with a SPAY, ovariohysterectomy, but these medical modalities are discussed in literature. They are plausible treatment options, but again, can't stress enough, surgery is the way to go. I've never talked about medical management in my career to people other than like antibiotics to sort of buy them time so they can afford the surgery if the patient is otherwise stable. That's about as far as that gets for me, but of course I'm a boarded surgeon, so I'm a bit more biased in what cases I see. Well, let's talk about medical management. It's in the literature and you may interact with this in your career. So why choose medical management? Well, maybe the dog is a valued breeding bitch, right? So they plan on breeding this dog again. And pyometra is not a congenital disease, it's not genetic in nature. So, you could, ethically speaking, breed this dog again. So if you're trying to salvage the uterus, okay, so they are used for breeding. Maybe the patient is healthy otherwise, or she's a young patient and the client is just electing to choose medical management because the dog is otherwise doing fine and they don't want to perform surgery for whatever reason, whether it's their own ethical choosing or whether it's financial in nature, whatever it may be. It's up to the client at the end of the day. Our job as veterinarians is give them the options, and then you can categorize those options from best to worst and let the client decide what they want to do. At the end of the day, it's their pet. Maybe it's an open pyometra and the dog is otherwise stable. If it certainly is hard to argue for medical management in a closed pyometra because those dogs are typically sicker and there's no way for that discharge to leave the body. You can throw all the antibiotics you want at that pet. It's not going to penetrate that pus-filled uterus. So it's an open pyometra and the patient otherwise healthy and the client declines surgery. Sure, maybe they have normal renal function. Yeah, sure. Again, everything else is fine. Then you could consider that. And so here are other reasons for medical management. Maybe the patient is not great with anesthesia. Either they had a previous complication with anesthesia, or maybe they have some other comorbidity that doesn't make them a good candidate for anesthesia, and the patient otherwise is doing okay, and it's an open pyo, et cetera, then maybe those combination of factors will give this client a reasonable indication that medical management might be appropriate, again, if they decline surgery. Maybe they have financial limitations, again, in combination with those other factors. You hate to put a dog to sleep because she has pyometra and really is a surgical candidate or needs surgery to survive and the owner can't afford it. If you were like, well, okay, a frank conversation with the client, I'll throw some antibiotics at you and some other hormonal therapies or whatever it is they can afford and see what happens. It's a discussion between you and the client. It's tough. Ethically speaking, it's tough. Maybe it's just owner preference. They don't want to do surgery, or maybe the dog needs preoperative stabilization before surgery. If they can wait and maybe they're hospitalized in your care and they benefit from a day of IV fluids, IV antibiotics, what have you, well, then medical management is used for preoperative stabilization. Perhaps the patient has endotoxemia so bad that it's developed myocardial conditions from it, and it's got cardiac arrhythmias, and you have to manage those before surgery. Maybe there are other things that can be affecting them. Maybe they have such bad azotemia that you want to see if you can lower that creatinine and BUN down to a more reasonable level before anesthesia. So we all know that anesthesia does sift through the kidneys, and so you don't want to compromise the kidneys any more than you have to. So maybe there is a reason to believe you can stabilize them more preoperatively with medical management. So these are all good points, all valid. Again, I'm a bit biased as a surgeon. I typically am cutting these anyway. When don't you want to perform surgery? Again, surgery is the ideal, but when don't you want to recommend medical management? When is it not an option? Peritonitis, yeah, the dog has evidence of SIRS or sepsis, right? So they're febrile or they're hypothermic. they've got a closed pyometra. Maybe they have concurrent diseases. If you're finding cysts or even a mass effect on the ovaries or in the uterus itself, well, then those are reasons to remove the ovaries and uterus. I mean, this dog has other conditions there that are causing problems. Maybe you end up collecting radiographs and you find out there's a dead fetus in there. That happens too. There are other causes of pyometra, not just the hormonal imbalance or the exaggerated response to hormones, but perhaps the bitch just gave birth and the owners never knew that there was a dead fetus or placental tissue that was left behind. Maybe the anatomic variation of this patient is such that that uterus just was never really healthy and it's always kind of sequestering these fluids, and now it's manifested as pyometra. There are other less common, but there are other reasons why pyometra develops, although most commonly it's the hormonal imbalance that we spoke about. So there's a picture in the bottom there of what I would consider a recessed vulva, maybe predisposing to ascending bacterial infection. There's another picture there, gross anatomy of cysts on the ovaries. And besides ascending infection, you may think to yourself, well, where does bacteria come from anyway? Like, why would it even be there? We talked about how E. coli and other bacteria can be normally found in the healthy reproductive tract of females. So it can be ascending infection, meaning it's originating from the vaginal vault and climbing upwards towards the uterus. That's one possibility. Hematogenous spread, another possibility. From the peritoneum is another possibility, and lymphatic access of bacteria to the uterus is another possibility. Those are your four. But and again, those categories can be argued for anything. Just replace ascending in this case to like direct or traumatic bacterial introduction into an organ, and you've got the same four categories for every organ that has infection. It's always the same level of spread. There's only certain ways that they can access organs, the bacteria that are implicated in these diseases. We're not going to go into really much detail with medical. This is the only slide. Your notes has way more detail, and all these stats are in there. All the different success rates. What is the ability for that dog to breed again? What's the recurrence rate for pyometra for those dogs? And so all that is outlined in your notes. Just wanted to mention, shout out to medical therapy. There it is, and you can read more about it. Again, it requires a specific case scenario, clear client communication. This is not the ideal. Surgery is the ideal for these pets. What are some complications of medical therapy? Well, uterine rupture, yeah, sure. Especially if you have a closed pyometra, why not? Inability to breed, yeah, sure, or well, fine. Peritonitis, obviously. Septicemia, obviously. Failure, yeah, sure. They have they can't give birth, or there is failure of the treatment to treating the pyometra. So sure, recurrent pyometra, yeah, obviously, because nothing's changed with these pets. You haven't done anything for their hormonal part, and the anatomy is still there. So those are all complications of medical management with pyometra. So with surgery, which of course is the standard therapy, which is, again, this condition is considered curative if with surgery. So you're trying to stabilize these pets. You're dealing with sepsis, maybe in some cases a septic abdomen, peritonitis. So you're doing all the things: fluid therapies, colloidal support, monitoring their heart rhythm, blood pressure checks, the blood work. Are they hypoglycemic from sepsis? You have to treat that. What's going on with the kidneys? You want to try and diurese them to get those kidney values down. These are all the standard things that you're going to do. And obviously, probably beyond this talk, I'm happy to answer any questions regarding stabilization. It all depends on how sick the pet is. And typically, these are cases that are cut on an emergency basis because they do come in fairly ill. And the quicker you can remove the source of infection, the better off they are with recovery. So I've uncommonly had to postpone surgery to stabilize them further. I typically am cutting them, that day or that night, depending on when they present, and then trying to stabilize them as much as possible as you're getting them ready for surgery. That's typically how these things go. It's just like GDVs and hemoabdomens. It's the same thing. You're sort of stabilizing them as you're going into the operating room. A bunch of different surgery techniques. Now, again, some of these, like for example, laparoscopic procedures, these are more preventative, right? You're spaying the pet. They don't have a pyometra. It's a young, healthy dog otherwise, and so you're performing these other more fancy procedures. The spay is what you're using for for pyometras. But again, in the literature, it does mention these, and so you have to know about them. And if you're ever asked, there you go. There's a list of surgeries that you can consider when you're trying to remove ovaries and or uterus for any condition. But a pyometra, typically, because they are quite distended with fluid, you're going to want a full abdominal approach. So ventral midline incision, and then removing the reproductive organs. And so here's just some various. These are all like some of these are from mine, some of these are from online. It doesn't matter. Most people have seen spades at this point. It's just a glorified spade at the end of the day. Once you stabilize the patient, realize what you're dealing with, tissue handling, all that stuff. But there's your surgery. And so some cool stuff you can use during the procedure. Now, obviously, I assume that for those of you who are going to continue on and perform surgery in practice, you're probably going to just use the typical sutures, and that's it. Fine, nothing wrong with that. These are some pretty cool tools you can use, like for example, the top middle, the EnSeal device, and then the middle photo. Those two are pretty cool. You've got basically oversized cautery, and so they have really powerful jaws. The middle one specifically is actually for laparoscopic, but I have used it for really tiny patients because it has such a fine jaws to it. And if you're in a deep abdominal cavity, that really long laparoscopic rod there is really good for deep cavities. So I've rarely performed laparoscopic procedures. I'm just not into it, but that instrument is really cool for like gallbladders and stuff like that. But anyway, so any kind of large bipolar sealing device is really fun for these because you can just zap the pedicles, and you've got a pretty good security knowing that you can, and they'll cut at the same time. So you can cauterize the pedicles, cut in between the jaws, done. And there's no suturing, no messing around with organs. You need less assistance with that, and so that's pretty cool. The let's see here. And it's with the top left too. You've got those jaws. So those three pictures there. So I don't have a pointer now on where the picture right above copyright 2022. That there. So it's a hemoclip. So very tiny staple in those jaws, and you can also grab pedicles and staple them with that. It's very tiny, and so if you're dealing with a fairly large sized dog, you're not going to have any. It'll be tough with that one. The bottom center picture there. Those hemoclips, that's a LDS, so ligating and dividing stapler, and so same thing. It's the same thing. It's got a staple and it'll cut. I've used a lot of those for splenectomies and stuff like that when you have numerous vessels. But again, just other cool ways of doing this. And so and then the bottom right above the vet triage logo, hemoclips there. Manually place a staple in there, push down, hold it, let it go. See how the staple. So anyway, there's a variety of different ways of performing, and these are for any procedure that involves vascular pedicles. It's not just for spades. I've done these with dog neuters. It just depends, just depends on what you have in your clinic, but your standard suturing is fine too. These complications of surgery are really for any spay. So this is the same list you'd use for spay complications regardless, but there's a list there. Some of these things are more like long-term, like, urethral sphincter mechanism incompetence and hypothyroidism, like, neoplasia, these are things that are like long-term, and then you have more acute, like the hemorrhage or pancreatitis, things like that, but these are just complications of a spay. As common as a spay is, we frequently forget it is an abdominal procedure, and it can result in pretty major complications, although it's fairly routine. The notes I gave you goes into way more detail regarding factors that affect prognosis. So these prognostic factors are all in your notes, and you can, as you read through these, you can tell they're going to be related to each other. And some of these are direct prognostic indicators for the disease. Some relate to causing an increase in hospital duration, which is then tied into a worse prognosis. So it's just like reading any GDV paper. They have 1,000 different factors, and they all sort of relate to each other anyway. So it's tough because you have a multi-systemic disease. And so if you're asked specifically, your notes has in the handout I gave you how these things affect these patients. But just realize there's many factors that can affect prognosis. The reason, why would you care? Well, the client may want to know. So if a client's on the fence, do I put my 12-year-old, 16-year-old dog in for surgery, even though it's just a spay, but they're sick? do I want to do that? And, maybe if you're finding some of these things on the preoperative diagnostics, you can talk intelligently to the client and say, hey, you've got the absence of leukocytosis. That's a concern. Those pets don't do as well as ones who do have a leukocytosis. Those things can affect the client's decision-making. But you do this long enough, you see patients that shouldn't make surgery recover nicely, and others that should have made it don't make it, right? It's medicine. You try the best you can, but that's the value in prognostic factors, is that you can educate the client as to what are the good and bad signs based on blood work, and so it kind of helps with that. By the way, these pictures, this is from Vet Triage. So I had a squirrel, somebody had a squirrel in their closet, and it had like a URI or something like that. And it was a fat squirrel. Now I'm laughing. I couldn't. The thing was so cute and so fat, and the client was kind of laughing because it wasn't really that sick. It just had nasal discharge or something. But and then this one is a picture from Vet Triage when I had some hair on my head. It's a skunked dog, and so we're bathing it together and having a blast, just talking about it, and the dog hitting the bath and how bad it smells and all that. And so finally, the outcome. So overall mortality, 0 to 27%. It's a pretty good prognosis. Even the really sick ones do so well if you can support them enough before, during, and after surgery, and treat them aggressively with surgery as quickly as possible in the right conditions. They do really well. Euthanasia, 10%. And whether that's client's decision or the pet had surgery and didn't do well, I don't know. It just depends. Uterine rupture, 50% are said to be that's a crazy number, and I don't know. When you go in surgery with these pets, you'll see they may have ascites in their abdomen. Obviously, by definition, it's ascites, but it may be more of a transmural spreading of fluid just from distended, severely distended viscera. And so things are just seeping through the uterine walls, and that's what you're seeing there. Plus, the inflammatory reaction from SIRS can also cause it as well. Any kind of translocation can result in ascites anyway. So whether that's like a rupture that you can't see, just kind of a slow leak, or not, who knows clinically. But I haven't seen too many ruptures other than caused by the surgeon's hands. But typically, I don't go in there and see just a ruptured uterus. It just doesn't be the case. So key points for all this information, I want to keep in mind, it is considered a complex. It's not just your simple, just an infected uterus. It is actually hormonal disease, and it's characterized by stages or types. And so cystic endometrial hyperplasia-pyometra complex, right? That's how it is. We're never going to call it that clinically, but that's just want you to have that in the back of your mind. If you're trying to figure this stuff out before diagnostics, and especially for a client who may have financial concerns, you can say the combination of PUPD, and you just had a heat done a few weeks ago, and you have all these clinical signs, bulbar discharge, whatever else. Pyometra is number one on my list. So if you're considering treatment for that, we should move forward with diagnostics and figure this out. Sepsis, SIRS, always at some level with any condition, not just pyometra. And of course, surgery is considered curative with this condition. Factors we didn't talk about, which I'm happy to if everybody's interested, depending on time and what have you. Post-op care, what do you do for them post-operatively? What if you find concurrent mammary gland tumors? Because mammary gland tumors are also hormonally dependent. And then what do you do if you have a client that's got financial concerns? The notes I gave you has all the tests, right? You've got blood work of various types. You've got urine testing of various types, radiographs, ultrasound, a bunch of really fancy blood work for like C-reactive protein. How important is that? Are you going to culture the uterine fluid, the pus? Are you going to biopsy the uterus and the ovaries? Are those things essential? What if you have a client that's got, a finite amount of finances, right? Most people do. So where are you going to prioritize those diagnostics and have the surgery done and do the post-operative care? So these are all factors to consider. A lot of these cases end up being, they weren't spayed for a reason. And it's typically not because they were a high value breeding bitch. It was usually because they just didn't want to spay them, because they just didn't want to, didn't find the time, didn't have the money for it. So now it's compounded by having a dog that needs emergency surgery, emergency spay, and who's also sick from it. So these are why I'm bringing up these factors now, because it's going to play a role in what you're talking to clients about and what they want to do. Any questions at all? I'm happy to take them either now or later. This is all my contact information. I also have my contact information in the notes as well. So you're welcome to follow or whatever, Vet Triage or me. And yeah, thank you so much for having me talk, and I'm happy to take any questions now.
Okay, thank you so much, Dr. Rasich. If anyone has any questions, yeah, please go ahead.
Do you want me to go over any of the other factors here? I don't know where you guys are at with time-wise. This is totally up to you, either way.
I am kind of curious about the diagnostics of which one you'd prioritize over the other in terms of the finances.
Yeah. So if you have a dog that fits the bill, right? Typical age, obviously intact female, had the heat, has the PUPD, has vaginal discharge, or even not. Maybe it's a closed pyometra and there's no discharge, but it has all the other things. My priority is going to be surgery. So I would be happy with a single like lateral radiograph or a flash of the abdominal cavity with ultrasound to just get eyes on a distended uterus and then cut them. No blood work, no ultrasound, like no official ultrasound, nothing else. Just there it is. She got the right signs, because the goal is to save the dog's life. And if I can confirm that she has a pyometra, which already is like 90% of the way there, just based on history and clinical signs and physical exam findings, and 10% as I see on a lateral radiograph, distended uterine horns, I'm cutting that dog. And well, you might say, well, what about blood work? Like, you don't know. This is a client that has financial concerns, but surgery can be curative. So I'm going to aggressively treat them as if they have all the things. I'm going to treat them with fluid therapy. They're going to be on antibiotics. And during the procedure, obviously we have things we have parameters that we're measuring, like blood pressure, ECG, pulse ox. Treat the things that are abnormal during the procedure, and as if they have all the problems. Because the surgery has such a good response, it's curative, and you have limited finances. So my priority first is surgery right off the bat. Now, let's say they're like, well, I'm not going to do surgery, but I want to know what's wrong, but I have limited finances. Well, then imaging is going to be your second priority, and typically radiographs. It's pretty good radiographs. Now, most ER hospitals have some kind of ultrasound machine that the emergency doctors are allowed to use, or if you're a GP, you sort of have one there, not for official consults, but so you can look for things like this, and so you can kind of scan the belly real quick and look for the classic distended uterine horns right next to the urinary bladder. You don't have to really know ultrasound to know that there should be two fluid-filled cavities next to each other. One is bladder and one is the uterus. And so, so typically imaging is going to be my second priority here. Let's just get eyes on this, diagnose it, and then from there we can talk about, okay, you're not willing to do surgery. All right, well, can we do some antibiotics, and see if that'll work for this pet, and then maybe it'll buy you some time to do surgery later if you can afford it later on. So that's my second, is going to be imaging, and then beyond that, the push for then standard blood work is fine. If you have enough metabolic derangements before surgery, well, after surgery, you're probably going to repeat blood work to make sure that those abnormalities are normal now. That requires more finances. So, do you perform blood work before or after surgery? Then, if you only can do it one time, your call. I either will do it no times if I don't have money for it, or I'm going to do it post-operatively. I rather perform the surgery and then make sure the pet looks pretty good on blood work before going home. That matters more to me than preoperatively. And again, we're talking about severe circumstances, right? And then the last thing I'll mention is, do you test the fluid from the uterus or not? It's really great to have a uterine culture, right? Because you can find out what bacteria are there, you can find out what antibiotics to use. But we do know that there's a pretty low resistance rate. It's like, what is it in your notes? I think it's like under 8% for resistance to enrofloxacin or Batrol, and maybe 9 to 10% resistance to like ampicillin with E. coli. So you can pretty much just assume it's going to be E. coli, and it's going to be pretty sensitive to whatever you want to use. Usually we're using some sort of penicillin derivative, So culturing, not that big of a deal. If I go in surgically and I do find that there's evidence of ovarian cysts or tumors or a uterine tumor, I'm going to push for biopsy more after the fact and say, hey, look, it'll cost an additional whatever for biopsies, but I did find this tumor. You may want to know what that is, and then let them decide if they want to do it or not.
Thank you.
Yeah, no problem. Anything else?
Well, that is that we are recording, so this can definitely go up. And if people have further questions, they can definitely reach out to you. But thank you so much for your time, Dr. Rakic. We really appreciate it.
No problem at all. Good luck in your studies and reach out anytime. You're very welcome.
Thank you. Have a great one. Great day.
Take care, guys. Bye-bye.
Yeah, thank you.
No problem.